Oftentimes we get patients that come in and they have forearm or carpal tunnel-like syndrome. They'll have the hand, wrist symptoms, and they just assume they have carpal tunnel syndrome. And sometimes, unfortunately, they've been misdiagnosed with that as well. But there's another type of issue that we see often in our practice, and it's called the pronator teres syndrome. And it mimics a lot like carpal tunnel, but there's a couple differences that we look for when we do the assessment and kind of ask you questions about what's going on. And it can clue us on to, okay, we don't have carpal tunnel syndrome, but we have pronator teres syndrome, and we can go in there and actually do some things with it. And typically when we're treating this, we're going to do some muscle work, which I'm going to show you today. But we're also going to do things like give you some stretches, some deep tissue laser therapy, and really give you an ability to heal with this that unfortunately a lot of other treatments don't. So I'm going to show you what it looks like here. The pronator teres is a muscle that's right here. The movement like that is called pronation. That's pronation. You've heard of maybe a pronated grip versus a supinated grip. And the pronator teres muscle actually helps pronate that. So as you can imagine, if you're sitting there typing all day, this is what gets it a lot, you're in pronation and you're using this muscle. Or if you're golfing, you're pronating there, or even tennis, right? And so this muscle, I'll go in when evaluating someone and we'll find that median nerve actually goes in that region there and bisects through where that pronator teres lies. So there could be some adhesions that's irritating the median nerve up here, not down here. The median nerve being entrapped is essentially what carpal tunnel is, but it can also be this pronator teres syndrome. And so I'll go in here, and a lot of times we'll find some tightnesses or tenderness, and I'll get in there and I'm going to go just like that. We're going to do our ART or active release technique. I'm going to shorten that muscle, and then I'm going to lengthen it as I release it really well there. And the patient will always say they can feel that muscle being released. And sometimes as we palpate it and look through it, we can reproduce the symptoms, which is actually a good thing for us. If we can reproduce the symptoms, I know that we're probably in the area that's causing it. And so I look for that from the patient as well. And so we'll get in there and we'll really release these muscles on the inside of the elbow and forearm. And then, subsequently give some stretches and some exercises and a little bit of deep tissue laser to help relieve that. And so pronator teres syndrome, something that we see not a ton, but when we do see it and we get the results, people are shocked because they've been through the rigmarole of thinking they had carpal tunnel syndrome. And so you may have pronator teres syndrome.